Hi all, welcome to Families USA's Insights blog. I'm Adina Marks, the Communications Associate, and we're joined today by De'Shea Coney, the HEP Connect Coordinator for the North Carolina AIDS Action Network. Before working with NCAN, De'Shea served as a prevention specialist at the AIDS Project of Central Iowa and on the board for the Iowa Community Planning Group for HIV and Hepatitis C. He also served on the board of the Des Moines Pride Center as a diversity liaison and a facilitator for the Gay Men Support Group. He is an expert in LGBTQ community outreach, and we are honored to have him here. De'Shea, thank you for joining us.
Oh my gosh, didn't know you have my whole resume. Thanks for having me.
So to start with, when did you first know you wanted to get involved in advocating for LGBTQ health?
Actually, I didn't know that I wanted to get involved with advocating for LGBTQ health. I'd done some work with the student organization in undergrad, and most of the proceeds from the organization, Walk It Out, go to the Eastern HIV clinics of Iowa. And I was a social work student, and I remember saying, I will never do macro level work. You'll never catch me talking to large groups of people. It's only going to be one-on-one. And then I ended up doing this. I don't know how. But as I was doing the work and interacting with, doctors and physicians personally and professionally, I really saw that there were a lot of things that were keeping me from getting the best care that I needed. Whether it be doctor understandings of LGBT culture, whether it be policies that are preventing me from accessing certain things. I realized that I had to be a bit more vocal and active, if not for my behalf, for the behalf of some of the other people that I knew that needed those resources, and to have access, like the same way that I needed it. So since I was in the position to do that, I thought it would be best that I just go ahead and push forward.
So why does the LGBTQIA community have unique health needs, and what are some of those needs?
In terms of what makes our health needs unique, I think it's really the care. And in some sense, I don't even think that that's what makes it unique. There's a human necessity for being able to connect with people and have some sort of empathy and camaraderie when it comes to addressing health needs, especially for individuals. And so it can be really difficult and challenging to find a physician or a doctor or a nurse that's going to treat you like a human being and actually listen to the needs that you have. So I know for myself, and I'm sure for other potentially Black men who have male partners, going to the physician, it's always going to be, do you have HIV? Are you sure that you don't? I don't trust it. Your group is known for being super hypersexualized, XYZ. So I had all these interactions with physicians where they were like, well, it's got to be an STD or it's got to be HIV. And I really feel like that really dehumanized not just me, but anyone else who may fit under those categories. And I was no longer being seen as a human. I was no longer being seen for the things that I needed help with, which was a GI thing. So I think the unique struggles are specifically finding physicians who are willing to listen to people who are in need within the LGBT community. I've heard stories about trans individuals who are going to get syringes so that they can, do their HRT, and then being outed by pharmacists because the pharmacist wants to know why you need syringes. And there's a group of people behind you. Like that's really traumatizing. So I think there's a need for education and care and understanding how what we do or don't say within those clinic walls can really affect someone's long-term health and determine whether or not they engage with the healthcare system in the future.
Yeah, absolutely. And you've touched on this a little bit, but I'd love to dive in deeper, like why those health needs and how those health needs interact with other minority identities and other minority communities.
So a lot of the work I do is related to harm reduction and Hep C education. And we do see some comorbidities between HIV and Hep C. And harm reduction started out of the HIV community. It is specifically for people who use substances, but it started out of the HIV community because no one was paying attention to the people who were dying and who needed that assistance. So the community had to jump in themselves. And so looking at how LGBT health interacts with other forms of health based off of minority identities. I'm thinking that we know that we need greater conversations around harm reduction within the LGBT community. We are seeing specifically in North Carolina, well, I want to say specifically in North Carolina, but really across the nation, that substances previously that didn't have fentanyl in them now have fentanyl in them. And so within the party scene, within what some people may call like the circuit gay scene, if there are substances being used, you need to have access to harm reduction supplies. There needs to be a conversation about that. That is now a public health need. And it wasn't always like that. So there's a need for these conversations because we may see that people within the LGBT community have higher rates of mental health needs. They have greater mental health needs than those who may identify as heterosexual. And that can lead to a plethora of different ways of, finding out how am I going to address my mental health needs without access to mental health care. And that may be substances. When we look at the intersectionality really with the Black community and HIV, we are seeing an increase in HIV amongst cisgender heterosexual Black women. And I think that it's really unfortunate, and it's really highlighting that HIV really is not just only affecting the LGBT community. There are people within other minority groups that are affected by HIV. We see it within the Latinx community, but we're really seeing it with Black women. And so, yeah, I think that it just adds another layer. And it adds a layer that is more transparent than what was originally thought. There was really this idea that, well, you have to be of this shade and of this background and have all of these categories and boxes checked off in order to potentially be at risk, but that's not the case. And so I'm hoping that this will actually increase the scope of the conversation for things like harm reduction and HIV, not just within the LGBT community, but within all communities, because many communities are affected by this, but really upping the harm reduction discussion within the LGBT community.
Yeah, definitely. I wanted to ask, what are you most proud of in your work right now with NCAN?
Ooh. Most proud of? Oh my gosh. I'm not really someone to take pride in my own work. Honestly, I do an assignment and I'm like, what's next on my plate? Because I know that it's overflowing. It's never like oh, I really did good on that. It's more, oh, I did that. I think the best thing so far has been working with the Hepatitis Ambassadors for Change, even though we don't get a chance to see each other very often. In fact, we didn't have our last monthly meeting where we all get together virtually and talk about some things we've been seeing. That's because we had our annual HIV Speaks on Jones Street event where we go and talk to some of our representatives, have meetings with some of the public health officials who are making those decisions about policies that will be impacting us. And so there's a lot of focus on that. But working with the Hepatitis Ambassadors for Change is so amazing because they all have such vast and different, varied experiences. Some have lived experience with harm reduction, some have lived experience with hepatitis, some have both, some have indirect experiences with their friends and family. And so when we do have these moments where we have to talk about harm reduction, or we do have to talk about hepatitis C, and they're like, I don't know if I can talk about it. I'm not as confident in being able to speak on this. But then we're having a casual conversation about it, and they're telling me all these things that they're seeing and ways that they can intervene and things and people to contact and reach out to. And I'm like, look, you already knew this information. You've got so much lived experience and so much knowledge and expertise that I don't want to say that you should necessarily have to feel confident in that, but you can't deny that those experiences are real and therefore they have real contributions that can be made. And so it's been great seeing them feel more confident in engaging with advocacy, in speaking up for their community, sometimes speaking up for themselves, and really just creating connection across the state, because a lot of people do harm reduction and hepatitis C work, and they may not necessarily know each other in that same area. And hey, you've now got a whole network that's just growing. So it's great to see the network grow, and it's great to see them build that knowledge and confidence.
That's fantastic. There's just like, you can see that they have so much to offer.
Yes. Oh my gosh. Yes. And I do some individual events with them. So we do try to have some larger events, but because we're all over the state, I'll just kind of go and visit them and see what they're doing in their area. And I just went to a prom, and at that prom there was nasal Narcan available, and I was like, it was like an adult prom, it was an adult
Yeah.
LGBT prom, but nasal Narcan
Yeah.
at a prom, that's so great, like that's so needed. And it's something that most people wouldn't have even thought of, but the HEP ambassador thought of that, and she made sure that it was available. And like, it's just things like that that really just kind of light up my heart, make me feel like, okay, it's not all, stagnant. There is progress even in the most unlikely of places.
Yeah, that's incredible. Just having that on hand and ready. Yeah. So, could you share some of your goals for next year?
Yes, goals for next year. Personally, my goal for next year is to be in grad school.
Awesome. That's fantastic.
That would be great, but things are expensive, gas is
Oh, yeah.
expensive, the rent is too high. So we will see how grad school is realistic, but
Yeah.
fingers crossed.
Feel that?
Oh, and I think really just seeing that all the work that I have helped with, I wouldn't even say the work that I've done, but seeing the work that I've helped with and the programs that I've contributed to, knowing that those contributions are long-term and sustainable, that someone else can come in and pick up the work with no issue. We know that there's a lot of there's high turnover in nonprofit organizations. I've seen it a lot in the harm reduction spaces recently. I've seen it in HIV spaces recently. So creating work that is sustainable for the next generation to come in and do is so important. And I want to be able to make sure that I do that and I leave something that is able to continue to be carried on. Not for myself for the sake of a legacy, but for the sake that the community is going to benefit from this long term. Even if we forget the original founding members and all their original founding work, the work is still being done, and we've forgotten because there's been so much progress that it's hard to believe that that's where we came from.
Yeah. Yeah, that's entirely true. And then, actually, on that note, what advice would you give to anyone interested in fighting for a more just and society, but without any idea how to start?
Advice that I'm taking myself right now: limit your social media engagement.
Yep.
It is, oh my gosh, I get on TikTok, and TikTok's where I'm getting some of my updates about things happening in Congress. And I'm like, I'm supposed to be on TikTok for fun, not for this. Or on Instagram or on Twitter. I would say that, it can be really heart-wrenching to get all these updates across the globe, not just in your state or your city or within our nation, just across the globe in general. And to have a defeatist attitude because there's so much happening. It's like, I'm just one person. How can I engage with all of this? So my advice is limit your social media interactions, not necessarily in terms of, interacting and fighting for your rights, but just try not to be overwhelmed. When you feel yourself getting overwhelmed, take a step back. Otherwise, you'll get burnt out. And the other thing is understanding that, like I said, your story is essential. I've got my own story for why I got engaged with within the HIV space and doing advocacy. And my story is not someone else's story, and that's because their story is unique and it's going to paint a perspective that mine couldn't. So really embrace that perspective that you have. Understand your why. Feel confident in your why, and then know that the people that we elected. So you have to vote. You have a choice in saying who's going to be your public servant. You really have to vote. You have to vote, and then hold them accountable. They are people just like us. They're working their jobs. You can send them an email. You can give them a phone call. They may be busy. They can take a message though. Really engaging and holding them accountable. So limit the social media overwhelming atmosphere. Find out what your why is. Build confidence in that why, and then engage and hold your representatives accountable, because they are going to think that we're okay with what's happening if we don't say something.
Yeah, absolutely. Well, De'Shea, thank you so much for joining us and for giving this interview. I really appreciate your time.
Yeah, thank you so much. Thanks for having me.